Investigation first caught a local drug rehab program lying to families and investigators. Now we've uncovered new claims which could be criminal. A local mother says NARCONON of Georgia billed her insurance company after she had already paid in full. Channel 2's investigative reporter Jody Fleischer is here with what she uncovered that has Georgia's insurance commissioner investigating for fraud. Jody?
Jovita, we dug through stacks of records and found bills for treatment patients say they never received on days they weren't even at NARCONON. We took what we found to state fraud investigators who have now opened their own case into potentially crooked care.
It shatters everyone, and it touches everyone.
19-year-old Emily Morton had been battling addiction for years. When her mom, Mary, found NARCONON of Georgia on the internet, she hoped it would be the last program they would need.
You're a desperate parent. You want to save your child.
They handed over Emily's license and insurance card. She toured NARCONON's classrooms and eventually signed this agreement outlining the total NARCONON program service fee of $15,000. Her mom paid in full.
We were instructed to bring 2 checks, one for the $15,000 for the program and then one for the housing.
At that point, did you think insurance was going to be billed?
No, because they had just basically said your insurance is not going to probably cover this. But I also didn't care. I would have paid anything.
And she thought she paid everything. But 7 months later, she logged onto her insurance company's website and noticed bill after bill from NARCONON. More than $166,000. Even for weeks Emily was sent home for bad behavior, dozens of Sundays when her mom picked her up, and a full week after she left the program.
It was ridiculous. I mean, they billed for $58,000 for a doctor visits that she never saw a doctor.
That doctor was NARCONON's medical director, Casey Locarnini, who runs this urgent care clinic in Dunwoody. Dr. Locarnini declined our request for an on-camera interview, but says he did not know NARCONON had billed insurance under his name until we started asking questions. One of Emily's bills also listed former medical director Lisa Robbins, who described her role at NARCONON under oath in 2010.
I was hired by them to do the physicals on their patients.
Did you ever visit the NARCONON facility?
No.
Her practice manager told us if they indeed did bill under Dr. Robbins, this is insurance fraud, and she's never seen a patient named Emily Morton.
Sounds like a problem to me.
We showed the evidence to Georgia's insurance commissioner, who immediately opened a criminal case. 8 of Emily's bills listed partial hospitalization, which her insurance company rejected, saying coverage is not available for your continued stay at NARCONON. But care could continue with outpatient providers. NARCONON is only licensed for outpatient care.
If they have done it in one case, chances are that they've done it multiple times.
We questioned NARCONON director Mary Reeser last fall when a Channel 2 investigation caught the program advertising as a residential facility.
I'm telling you, I do not represent this as inpatient. How could I get away with that? Somebody comes in, they're not going to see beds.
But state records showed 21 out of 28 patients told inspectors they were part of NARCONON's residential program. The housing for $1,600 a month, 4 patients to an apartment in this complex.
They didn't say it's just an apartment complex that anybody can live in. It's ridiculous. They're preying upon the most vulnerable of people.
NARCONON is now fighting to keep its state license. Emily's mom says she picked up the same drug-addicted daughter she left there.
Not one more person needs to be checked in there. Not today, not tonight, not tomorrow. It needs to stop now.
We are happy to tell you Emily is midway through another program that appears to be working. NARCONON's director, Mary Reeser, and Dr. Locarnini both resigned within the past 2 weeks. And NARCONON's attorney sent me a statement saying it follows customary and usual billing practices and that payment terms are clearly explained.
So if this turns out to be something that's provable, how serious of a crime are we talking about here?
Well, fraud investigators can't charge an organization or a company with anything. They would have to find a specific person who's responsible. If convicted, it can mean 2 to 10 years in prison and up to a $10,000 fine.